This is the next bit bite-sized. I'm Hannah McQueen. I sat down with geriatrician Dr. Cheryl Johnson for two important conversations: how to stay out of hospital as you age, and when it's time to put your spouse into care. If you haven't heard the full episodes yet, they're here where you found this episode. Here is one key insight, one moment that matters from those episodes. Okay, so take us through a scenario where you might come in for something that is treatable, and you're admitted maybe because there's complexities or whatever happens in that clinical setting that I kind of brush over.
Yep.
And that is one of the reasons why people often aren't discharged out of the emergency department, right? It's like we've actually got to do, there's more to this, or there could be more to this than what we're first seeing, and that more to it takes time and normally a multidisciplinary team assessment. So off you go, waddling into the ward. But you come in for something that, let's say, is quite inane. Don't even know what that means.
Innocuous or mild.
Mild. Yeah. Mild, thank you. But you go to hospital and it actually creates a domino effect in the wrong direction. That's the bit that we need to understand. Can you bring that to life for us?
Yeah. I'm going to do quite an extreme example, but it's actually not that extreme. So let's say you have a fall.
Yeah.
Or let's say, you might have been out in the garden and you might have, hurt your back, strained a muscle. Okay. You've tried to sort of manage it at home. You might have gone to your GP and, got some medication to try and help your pain, but your pain gets worse and worse and worse to the point where you're in bed, you actually can't get out of bed, you can't look after yourself, you live alone, you come into hospital.
Mm-hmm.
So you get into hospital, and if you can't walk, we can't send you home. It's as simple as that. So that person will then get admitted. We'd look at their pain relief. A lot of the pain relief medications we give, like opioids, like morphine and codeine and things like that, will cause constipation. So the person gets constipated. When you get constipated, you get urinary retention. So the bladder doesn't empty properly because of structural and anatomical changes. The person's also not walking, and that's not great for your bowels either. So that kind of exacerbates the whole constipation. I haven't finished yet. So their bladder stops working. We put a catheter in. Catheters the catheters get infected, because there's a tube going into a bladder. So now we've got an infection. So we start you on antibiotics. Some antibiotics, because of what happens in changing the natural bacterial flora or the bacteria that sits in your gut, you can get overgrowth of another bacteria, which then leads to diarrhea. And that can actually be quite serious.
At least your bowels are working at this point.
Okay, we've fixed one
lining.
problem. Sorry, we've fixed one problem here. So, all the while, this person's in bed because they're unwell. They've got a catheter in, so they don't have to walk to the toilet because they don't need to. They're a bit constipated, so they're not, we're trying to get their bowels going. So their muscles weaken. And then, they might get up in the night, or, they might be trying to just even get out of bed or sit in a chair. They have a fall. If they have a fall, they might break something. You can see how the spiral kind of continues. One thing leads to the next. And as you said, that domino effect. That's extreme. Usually it may be 2 or 3, but sometimes you do get a whole lot of things stacking up against each other. And then in that, there's things like delirium. So if someone's at risk for getting delirium, which is an acute brain failure, i.e. the brain's not working properly, if you're at risk of that, say you've got cognitive impairment or dementia, we add in medications, which can make that worse. You add in the environment that people are in. Hospitals are quite strange places. There's not always a lot of natural light in every
And you're not
room.
sleeping usually, right?
Well, you're not sleeping. People wake you up in the middle of the night to take your blood pressure. So you're not, you're constantly woken up. There's just so many things that happen that just make the whole hospital admission really complicated, and just things can get worse and worse and worse and worse and worse when the original problem was, as we said, quite minor.
Yeah, you shouldn't have been doing the gardening on the Saturday. You wouldn't have hurt your back, and then off you go.
Yeah. Although good to be getting out.
I know, I was just thinking.
Active. So you've got to, you've got to kind of temper it a bit.
Damned if you do, damned if you don't. Okay, so a couple of things I want to pick up there. When you stay in hospital, the longer you stay in hospital, they say that you start to lose strength or something like that. What's that?
Yeah, it's a condition or a phenomenon we call deconditioning, so that all muscles weaken. So you and I, we get sick, we get the flu, right? We're going to go to bed. Even if we're in bed for 2 or 3 days, all of our muscles start to weaken. For you and I, we feel a bit rubbish, and we can sort of manage it. And, over the next days, once we start getting back into our routines, we gain that muscle mass back. But if you're an older person and you're in bed for 2 or 3 days, all your muscles are going to weaken. And the important ones are going to weaken too. Respiratory muscles, so your big diaphragm muscles and all those muscles around your chest weaken. Your muscles of swallow can weaken. So then you now have problems swallowing food or fluid that might go into your lungs and cause an infection. If you're smaller, you've got less muscle mass. So you've got, less of it to lose when you start to decondition. As we age, our muscles also change. It's for everyone. The muscles themselves get a bit smaller, and they also have more fat within the muscle fibers. And that's an important thing when we think about drugs and how drugs work, but also the muscles themselves aren't as good as they used to be. So a few days in a bed, people are going to weaken, and then it's going to become harder to do activities. So your big, shoulder muscles, your big glute muscles, your big thigh muscles are all going to start to weaken. Then it becomes really hard to try and get yourself out of bed.
It sounds quite depressing. And I was actually just thinking my glute muscles are already weak, so I don't know what's in store for me there. So if we go back to, I guess we want to make it clear, if you need to go to hospital, go to hospital. This isn't about pretending you don't need to avoid going. I guess the main message is we're trying to keep you legitimately away from that point in kind of a decline trajectory. That was The Next Bit Bite-Sized. The full conversations with Dr. Cheryl Johnson, how to stay out of hospital as you age, and when it's time to put your spouse into care, go much deeper. These are the decisions that shape the next chapter. You can find them right where you found this podcast. Please subscribe so you don't miss out on important conversations on aging.